in dental school, medical school, and any healthcare school, we are taught to do certain procedures, right? I mean, how to take out a tooth, how to do a veneer, how to do aligner therapy, so and so. And I think when you change the perspective that you're actually dealing with another human being, it changes the way you do the procedures that you do. Because when I'm doing the procedure is not to do a procedure and to get paid and to submit it to an insurance company. I'm doing a procedure to improve the quality of that patient's life.
Welcome to Schein Chats. The phenomenon of treating people, not patients, isn't exactly new, but it's gaining renewed interest in healthcare. Dr. Sonick, we're thrilled to have you join us today to talk about what that means and why it's important in healthcare, and how you've built a patient-centered, state-of-the-art practice. Thank you for joining us.
A pleasure to be here. Yeah.
What is the difference between treating someone as a patient versus a person?
Yeah, it's a good question, and it's the title of my book. I came up with the title of the book about 10 years ago, and when I first did it, one of my colleagues, Ken Varner, who's head of education at ZimV, he says, I'm interested in what happens to that name and the title as you write the book. COVID came along, I wrote the book during COVID, and never changed the name. It was just sort of like, well, that's where I always felt that practice should be, because it's people-oriented. So, in dental school, medical school, and any healthcare school, we are taught to do certain procedures, right? I mean, how to take out a tooth, how to do a veneer, how to do aligner therapy, so and so. So those are just procedures that we do, but we oftentimes don't know why we're doing the procedures and what their impact are going to be. And I think when you change the perspective that you're actually dealing with another human being, it changes the way you do the procedures that you do. Because when I'm doing the procedure is not to do a procedure and to get paid and to submit it to an insurance company. I'm doing a procedure to improve the quality of that patient's life. And I think when we're sort of patient-centric, great things happen. Patients are happier, I'm happier, our office is filled with people wait to get in to see us, and I feel like when I go to bed at night, I'm doing the right thing. I'm not doing it just to make a living.
That's right.
So,
and I really appreciate that whole health, the systemic health care that you're talking about, right? It's not just oral health, it's the whole body health, and yet we know that the mouth is the gateway to the entire.
Yeah, my network is not just orthodontists and endodontists and prosthodontists and restorative dentists. My network includes anybody that can help my patients get healthier. So we have a document in our office, it's called Top Docs. You want to call me, anybody, I'll be happy to send it to you. It's all the top doctors in my area at every specialty: neurology, dermatology, psychiatry, but I have it throughout the country and the world. So if you're traveling, if one of my patients is traveling and they're stuck in Paris and they have a toothache on a Sunday, they call me up. I have a periodontist that can see them on a Sunday there. And so I keep on adding to that, and that network gets larger and larger and larger, and it's pretty cool because the world's gotten very small.
Well, I would certainly appreciate that patient experience through the collaboration of all of those providers that you're bringing together. I applaud you for that, Dr. Sonick.
Well, thank you.
That's really important.
It sort of makes sense, right?
Well, the healthcare model today is already complex enough.
Yes, it is.
Right, and I know you have some patient experience pet peeves. I heard of one in your session. What are some of those patient experience gaps that you see in the healthcare model today?
Well, it's what we're doing now. We're making eye contact. That doesn't happen a lot of doctors' offices.
Connection, engagement.
Yeah. It's all about connection. So my book is called Treating People, Not Patients. But it's basically, I'll give it to you, be nice to people. It's 4 words. Be nice to people, give people a good experience, and do the right thing. But we don't always bring that to healthcare. And I think that part of it comes from a lack of, and I didn't discuss this in my lecture, the lack of confrontational tolerance. We don't always want to say what we need to say. So I don't know, how the patient going to handle that? What if I tell the patient that they have something that they may not want to address? As simple as bad breath.
Yeah, absolutely. Yeah. You mentioned earlier also about school and being taught to do procedures. What can we do from a medical education training to really prioritize patient-centered healthcare?
Well, the model that I was taught, at the University of Connecticut, is that we have to treat the complete patient. The first thing that you have to do after you do your diagnosis and your exam is you come up with a comprehensive treatment plan. And that's been in the books for, hundreds of years. That's nothing new. We just have to follow through with it and not focus so much on doing procedures.
You speak a lot about follow-up, and you call the patients directly yourself.
Right.
Usually on day 3, you said, when the pain is really high. Follow-up for us at Henry Schein and our customer experience sentiment is also extremely important. Talk a little bit more about why follow-up is critical to your business success, but also to the patient's success.
Let's talk about
their
it in any business. In any business, follow-up is great. So that's something that I think the doctors should have responsibility to our patients to tell them what their risk is if they don't follow up. So at the first day, when I meet a new patient, so if you were my new patient and you have periodontal disease, I'm going to tell you what your diagnosis is, what your treatment plans are, and if we're going to go through treatment. But I'm also going to say to you, that if you go through treatment, you have to commit to get your teeth cleaned every 3 months. And it's become part of my protocol. So I'll say to you, do you commit to getting it done? And you're going to say yes or no. I go, no, that's not it. And I do the whole thing, and I make my patients say, I, John Smith, commit to you, Dr. Sonick, to get my teeth cleaned every 3 months for the rest of my life. And I say, do you really commit? And they go, yes, I do. Do you commit? Yes, they do. Then they go through the first phase of treatment, and they come back and I reevaluate them. I said, I need you to get your teeth cleaned every 3 months. And they go, yeah. I go, you remember our conversation? They go, yes, we do. It becomes what we call a significant emotional event, where you actually capture them, and at that point in time, they're committed. Unless you can get people to connect emotionally, because that's how we remember. In storytelling, they are not going to follow through. That's how you have to get it done.
That's absolutely right, Dr. Sonick. An exceptional experience is an emotional experience. And you have to help your patient, your customer, come along that journey with you to understand the why. I love that. A heartfelt thank you to you, Dr. Sonick, for your valuable insights.
Thank you.
But everyone, let's carry forward the wisdom that was shared today, and specifically prioritizing empathy and individualized attention for healthcare. Thank you for joining us on Schein Chats.